Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. Let's talk about the April highlights, or lowlights, if you will, from the VA's OIG. It's always good to kind of keep a pulse on some of the garbage that's happening out there and making sure that bad actors are getting caught with their pants down. So with that, let's get ready to jump into this. I'm going to throw on a special thank you to Blade 979 2000. Blade, thank you so much for the super comment, super chat. I really do appreciate your support very much. Thank you, Blade. Let's jump into this. The VA OIG, Office of Inspector General, April 2025 highlights. They did a congressional testimony. That was one of the things that they covered there. The OIG actively engages with Congress on issues affecting veterans programs and operations. The OIG is essentially the watchdog over the VA, and their participation in congressional hearings helps focus legislative action and elevates national attention on topics of concern within the veteran community. All written statements to Congress can be found at the OIG's website if you are so inclined. With that, let's jump into this. Hit the thumbs up for me, subscribe, share with a friend, all that good stuff. I really appreciate it. Every thumbs up, every minute watched really actually does make a difference. That is what tells YouTube that we are paying attention. And let me throw this out there for those who don't know. I have been told by multiple staffers that their congressional members, either House or Senate, that somebody in their office, they're watching the channel. This is important because the more that we comment, the more that we watch, the more that we thumbs up, the more that we expose, the better. Because I'll tell you, many hands make light work. And when we're working together, we can actually get things done. And, you know, it's an all-together thing. Anyway, let's move on. So the Office of Investigations is one that I like to focus on here. They'll have healthcare investigation stuff, and then they'll also have some benefits investigation. So this is usually the two that I'll cover on here. So one is the healthcare side, VHA. The other is the benefits side, VBA. So let's jump into it. Office of Investigations. Healthcare investigations, drug and alcohol rehabilitation centers agree to pay $19.75 million to resolve False Claims Act allegations. All right. The VA OIG has intensified its efforts to stop fraud associated with residential substance use disorder treatment facilities that overbill VA using a variety of schemes, including billing for treatments not provided, while failing to provide high-quality care to veterans by qualified clinicians. This multi-agency investigation resolved allegations that a drug and alcohol rehabilitation facility, Seabrook House, submitted claims to VA Community Care Program and New Jersey's Medicaid program for short-term residential treatment and partial hospitalization care, for which it was not properly licensed or contracted, and misled state inspectors. Specifically, that from January 2022 through December 2024, Seabrook provided services for which it had no license, sought to conceal improperly performed services from their state inspectors, and failed to employ a sufficient number of properly credentialed caregivers. Seabrook also allegedly provided the same care to veterans as other patients while claiming to provide specialized care, and maintained false, inconsistent, and inadequate records of care. In a civil settlement, Seabrook agreed to pay $19.75 million to resolve False Claims Act allegations of this amount. VA will receive $19.15 million. This investigation was conducted by the VA OIG and Department of Health and Human Services OIG. The case was handled by the U.S. Attorney's Office for the District of New Jersey. It was the first such case involving VA substance use disorder programs resolved with the assistance from the OIG for the VA. All right. Whew, that was a lot. Next one, national chain pharmacy. A national chain, this could be one in your backyard. National chain pharmacy agrees to pay up to $350 million for illegally filing unlawful opioid, for illegally filling unlawful opioid prescriptions and for submitting false claims to the federal government. Another multi-agency investigation resolved allegations that a national chain pharmacy filled unlawful prescriptions for excessive quantities of opioids and then sought payment from Medicare and other federal health care programs, to include the Civilian Health and Medical Program of the Department of Veterans Affairs. That's CHAMP, VA. The pharmacy agreed to a $300 million civil settlement with the Department of Justice to resolve allegations that from approximately August 2012 through March 1st, 2023, that's a long time, its pharmacies and various subsidiaries filled millions of fraudulent prescriptions for opioids and other controlled substances in violation of the Controlled Substances Act and False Claims Act. The pharmacy also agreed to pay an additional $50 million if the company is sold, merged, or transferred prior to the fiscal year of 2032. VA's portion of the settlement is approximately $632,000. This investigation was conducted by the VA OIG, Department of Labor, OIG, HHS OIG, Federal Bureau of Investigation, Drug Enforcement Administration, Defense Criminal Investigative Services, Office of Personnel Management, and Defense Health Agency. Whew, that's a lot too. Next one. Home healthcare company. Home healthcare company owner sentenced to 4 years in prison for healthcare fraud and tax crimes. The owner of a home healthcare company routinely billed federal healthcare programs such as Medicare, Medicaid, and VA for services not rendered from 2016 to 2021. The owner also concealed that she was excluded from participation in all federal healthcare programs due to a prior drug-related felony conviction. She was sentenced in the Southern District of Ohio to 48 months imprisonment, 36 months supervised release, and ordered to pay restitution of more than $8.4 million to Ohio Department of Medicaid and more than $195,000 to VA after previously pleading guilty to healthcare fraud and making and signing a false tax return. This multi-agency investigation was conducted by the VA OIG, Internal Revenue Service Criminal Investigation, Medicaid Fraud Control Unit of the Ohio Attorney General's Office, U.S. Secret Service, and HHS OIG. Next one here, National Sales Director for a mobile diagnostic company pleaded guilty to a kickback scheme. This investigation resulted in charges alleging that the National Sales Director for a mobile diagnostic company and others entered into improper agreements through which physicians were paid bribes and kickbacks to order unnecessary transcranial Doppler tests, and an operations manager for the mobile diagnostic company and 3 physicians previously pleaded guilty in connection with this scheme. The potential loss to the VA is approximately $650,000. The director pleaded guilty in the District of Massachusetts to conspiracy to violate the anti-kickback statute. The investigation was conducted by the VA OIG, U.S. Postal Inspection Service, Internal Revenue Criminal Investigations, HHS, OIG, FBI, DOL, Employee Benefit Security Administration. Whew! All right, so with that, I'm going to end it here. This is the healthcare investigations on the VA OIG site. I'm going to do another video on the benefits investigations. Thanks for watching. I appreciate you. Have a great one. And remember, if we don't take care of each other, something went wrong.